So the first thing to know is it takes usually about 11 and a half to 16 months for someone to even get a diagnosis of ALS. That's from when they notice their first symptom, and that can be a really challenging diagnostic odyssey. So the problem lies that if we're looking at a year and a half for someone to get the appropriate diagnosis, that was the background to why we created the thinkALS Toolkit. So what this toolkit does is it provides a checklist, and I've got one here. It provides a clinically proven checklist of common diagnoses or common symptoms of ALS, and a clinician, specifically the general neurologist, can look at this checklist, and there's exclusion and inclusion criteria on here. And what this does is really get to an ALS diagnosis quickly, or perhaps a little quicker. And another part of this is it's identifying clinical suspicion. So for someone that is not able to make that diagnosis themselves, they can still refer out but indicate that there is clinical suspicion. So while this toolkit is for that general neurologist, it is a resource to help them identify faster. But if they use it also as a referral toolkit for a faster referral, that works as well. So we find that folks living with ALS typically see 3 to 4 different consultations with physicians or different medical providers before they see a specialist that actually makes that diagnosis. There are a lot of different misdiagnosis examples. I would say the 2 most common that we hear, or 2 common that we hear, are carpal tunnel or spine surgery, and those are completely unnecessary. Not only does that delay the diagnostic odyssey, it also is psychologically negative, and there's a lot of impact with being sent for unnecessary medical treatments. It's a financial burden, and then of course delaying that actual diagnosis is a real problem, because there's so much that happens post-diagnosis, and the importance of an early diagnosis is tenfold. Truly, there's so much that happens that needs to happen with that diagnosis. Some of the reasons that we are really passionate about the early diagnosis is it allows someone to have access to FDA-approved therapies that are approved for symptom management of ALS. It also allows for that individual to be referred to a genetic test and counseling. There is a genetic component of ALS. Of course, not everyone has genetic mutation, but we do have FDA-approved therapies for one of the genetic variants of ALS. So someone getting diagnosed as quickly as possible, getting a genetic test, allows them to access that medication and improve their quality of life through even just access to a medication. It also impacts clinical trials. We know that there are a lot of clinical trials across neurology, and there are clinical trials actively recruiting in ALS. But if someone doesn't know that they qualify for those trials because they don't have their diagnosis, it's another really critical reason for us to promote that early diagnosis. And then of course the psychological support, the caregiver support. At the ALS Association, we have support groups, we have resources for the psychosocial aspect of managing ALS and really making sure that the whole family that is impacted starts to benefit from those resources. So the reason that we are at AAN is to get in front of as many general neurologists or non-neuromuscular specialists as possible. Our neuromuscular specialists, physicians, they're thinking ALS already. Of course, we love to talk to them, we love to see them, but the goal of the thinkALS Toolkit is to promote thinking ALS to folks that might not always be thinking that for their patient population. We know it might go a long time for a provider to see someone with symptoms of ALS, and so there are a lot of neurological conditions that all of these different specialists have to be thinking through. But this toolkit, it's laminated, it's small. We're hoping that folks will put this on their desk, or they will see it. It will offer that visual reminder that maybe I should be thinking ALS, and getting from the general neurologist to the specialist as quickly as possible, using this toolkit to say even, I'm not ready to tell the patient that I'm thinking ALS. I'm not ready to make that diagnosis because I really want them to see that specialist to ensure that it is the right diagnosis. But going back to that clinical suspicion of ALS, it's a great way for that patient to get to their specialist faster and again, get to that appropriate diagnosis faster.